Hello, my name is Valeria, and my presentation is on the acute effects of the phytocannabinoids THC and CBD on postictal hypoxia. This study focuses on one of the most prevalent neurological diseases, epilepsy, which is a chronic neurological disease characterized by recurring self-generated seizures. After a seizure, a phenomenon known as postictal hypoxia occurs. This is an extended period of severe regional brain hypoxia where oxygen levels fall below 10 millimeters of mercury, the severe hypoxic threshold. In the oxygen trace, shown to the right here, we can see what postictal hypoxia looks like. A seizure is followed by a drop in oxygen below the severe hypoxic threshold into the red zone for about an hour before we start to see recovery. Postictal hypoxia is partly caused by local blood vessel constriction, which reduces cerebral blood flow. It contributes to many seizure-related comorbidities as oxygen deprivation significantly alters cellular physiology. Clinically, this may lead to memory deficits, muscle weakness, and contributes to sudden unexpected death in epilepsy. Over half of epilepsy patients experience at least one comorbidity resulting from seizures, impacting quality of life. Yet postictal hypoxia remains untreated in clinical populations. The major phytocannabinoid derivatives, CBD and THC, act on the endocannabinoid system, which is widely distributed in the body and brain. Previous studies have explored their vascular effects, suggesting potential to improve blood perfusion, which is relevant to postictal hypoxia. However, findings are mixed, with reports of both vasodilation and vasoconstriction. Some studies indicate that CBD and THC can increase cerebral blood flow. If this holds true in the hippocampus, the brain region observed in this study, they may help raise oxygen levels after seizures. To improve clinical relevance, this study used different routes of administration, inhalation and ingestion, common human consumption methods of cannabis, rather than injection, which is often used in animal studies but may influence effects on brain oxygenation. Our hypothesis was that when CBD or THC is administered prior to seizure elicitation, we should see an increase in local tissue oxygenation, preventing postictal hypoxia. Our two aims for this study were to assess the efficacy of acute vaporized CBD and THC in preventing postictal hypoxia in both male and female rats, and the same but using oral administration. For the methods of the study, we implanted an oxygen-sensing optode and a bipolar electrode into the hippocampus of rats. They were then kindled an epilepsy animal model involving twice daily electrical stimulations for at least 10 days to increase seizure severity and produce the postictal hypoxic profile. For the vaporized phytocannabinoid study, as seen in the video down here, rats underwent a 15-minute vape session with 10-second puffs every 2 minutes before seizure elicitation. For the oral study, CBD and THC were administered via oral gavage. A flexible gavage tube was inserted through the mouth, and we waited for 90 minutes to reach peak cannabinoid levels before eliciting a seizure. These are the results of the vape study. On the left, female data showed that CBD, as indicated by the green trace, improved postictal hypoxia as oxygen levels stayed above the severe hypoxic threshold. We then assessed drug efficacy using 3 measures: area below the severe hypoxic threshold, which was severity, time under threshold, so duration, and by comparing the relative drop in pre-seizure oxygen to post-seizure oxygen, we got a normalized comparison between animals. Now, male data on the right here showed a similar effect, though CBD's effect was more robust in females. This is possibly due to dose-dependent effects. In both sexes, vaporized THC had no significant impact on postictal hypoxia. Additionally, seizure duration was unchanged by either drug. These are the results of the oral study. In females, on the left, no changes in postictal hypoxia were observed after either drug administration. In males, on the right, oral THC, as shown by the purple, prevented postictal hypoxia, as shown by the oxygen trace, and reductions in area and time below the severe hypoxic threshold. CBD showed no effect, likely due to its low oral bioavailability, and the sex differences highlight the importance of studying sex as a biological variable in research. Through this study, we can conclude that only acute vaporized CBD is able to ameliorate postictal hypoxia in both sexes, and only acute oral THC is able to ameliorate postictal hypoxia in males. Future research will involve a chronic study to assess whether tolerance or sensitization develops to these drugs. Additionally, since phytocannabinoids act on multiple molecular targets, we aim to identify the key receptor involved in tissue oxygenation. Based on prior studies, we suspect the CB1 and adenosine 2A receptors to play a role. To test this, we will use receptor antagonists to determine if they can block the effects of CBD and THC on postictal hypoxia. I would like to acknowledge the Hill Lab for their help with the phytocannabinoid protocols and the Tescu Lab for taking me in as one of their own. These are my references, and thanks for listening. I hope I was able to get you excited about epilepsy research.